Here at 3 News Now, we've teamed up with the Alzheimer's Association to tell you about what they're doing to combat this life-changing disease. We've talked a lot in the past about resources for patients and caregivers. Today, we're talking about important research advancements. I'm joined now by Dr. Keith Fargo. Thank you so much for coming in to talk with us. You were in town for a UNMC symposium. And we want to talk specifically about this new promising news that came out relatively recently. Biogen is the medication.
Well, Biogen is the name of the company that is developing the medication. The medication has one of these long names that's impossible for people to pronounce, but it's aducanumab. And what this medication is it's an antibody against the amyloid plaques that are part of the Alzheimer's disease process. And what they announced just a couple of weeks ago is they had positive phase 3 clinical trial results, and they're looking now to submit this drug for approval to the FDA.
Why is this groundbreaking in some senses when it comes to Alzheimer's treatment?
It's absolutely groundbreaking. It's a game changer. The medications that we have for Alzheimer's disease today are what we call symptomatic medications. That means that they can treat your symptoms for a period of time. They may help you with your memory for a while, your thinking for a while, but they're not doing anything about the underlying disease, the underlying Alzheimer's disease that is causing those symptoms. So the plaques continue, tangles continue, you continue to lose brain cells, etc. But this new medication, if it's approved, would be the very first medication in history that actually slows down the process of the underlying Alzheimer's brain disease, potentially prolonging life. So not just treating the symptoms, but changing the course of the disease.
And this is able to come about because of the research that's been done to show the plaque specifically. I mean, it's really a process to learn about the disease so that you know how to treat it.
Yeah, that's exactly right. So if you go back not too long ago, we didn't actually know who had Alzheimer's disease until after they passed away. We knew who had the symptoms of dementia because we could tell who was having problems with their memory and thinking, but we didn't know why, because there are many different reasons that people can have dementia. Alzheimer's is the most common, so most people who have dementia have it because of Alzheimer's, but you couldn't tell until a person passed away whether it was Alzheimer's or some other disease like Lewy body disease, frontotemporal degeneration, etc. But now we have new technologies that allow us to look inside the living brain to see who has Alzheimer's disease. That allows us to get the right people into clinical trials and test drugs that will actually slow that disease down specifically.
How long have you worked in this field?
About 6.5 years. But I've been a neuroscientist for about the past 15 years. Just moved over into Alzheimer's about 6 years ago.
And would you say even in that short amount of time, you've seen quite a bit of progress when it comes to how we're dealing with Alzheimer's disease?
Enormous progress. And a big part of that is the research investment that's been made, not just by the Alzheimer's Association, but by Congress as well. Funding for dementia science has increased from under $500 million a year to now $2.4 billion a year, just since I've been working at the Alzheimer's Association for 6 years. So we are entering now a golden age of dementia science, and we're getting ever closer to not just slowing the disease, but potentially even curing the disease or preventing people from developing it in the first place. It won't be too many more years until we're talking about Alzheimer's the way that people talk now about things like polio.
Wow, incredible. I know a lot of people watching this at home finding a lot of hope in your words today. So thank you so much for the research you're doing, and thanks for coming in today.
Oh, thank you for having me.